Welcome back to the Big Ranch Show. Thank you for joining me. Today we're going to talk about some news coming out of the White House from the Biden administration over trans youth care, and I believe it has some pretty big implications, and it's also very problematic. Now, before any of you start thinking, you're just going to sit there and advocate for surgeries because you're this or that. No. The fact is, like I said, they are exceedingly rare that for surgeries to happen in transgender youth. It's something that just doesn't happen that often. Have they happened? Sure. Some people, and sometimes they've happened outside of the purview of proper protocol. That has happened, and that doesn't shouldn't be allowed to happen. But what the Biden administration has done is come out in opposition to trans youth having any kind of gender affirming surgery. Now, typically, surgeries don't tend to happen until 17 plus years old in most places, at least in the U.S. I have heard of some top surgeries taking place for trans boys that are seeking to not look feminine, but typically that's not even all that necessary early on because of puberty blockers, which are still being used, but also they do it can be detrimental to a trans person if they're developing parts that they don't identify with. Right? So it's not perfect science. There's nothing perfect here. Every human being is different. Every human being has to be looked at differently and treated differently. Not every trans person is the same. Not every trans person wants to have surgeries. Not every trans person is a candidate for surgeries, especially early on. But if it's something that is literally going to kill the child because they're going to unalive themselves over it, then maybe we have to do something and allow the surgeries to happen. Now, we'll talk more about this as we get into this article, but let me look at this article. If it looks like I'm looking away, it's because I'm trying to read this stupid article. White House says gender affirming surgery should be limited to adults. This is from The Hill. The Biden administration said it opposes gender affirming surgery for transgender minors, deviating from past statements that broadly support gender affirming healthcare for youth and angering LGBTQ groups that have backed President Biden in his race against former President Trump. Going on, a White House spokesperson told The Hill in an email that while the administration supports gender-affirming care for minors, which represents a continuum of care, it believes gender-affirming surgery specifically should be reserved for adults only. The administration's statement, which first reported by the 19th News, drew swift criticism from influential organizations and figures who accused the administration of abandoning its commitment to transgender youth and going back on its promise not to insert politics into private medical decisions. The Biden administration is flat wrong on this, Kelly Robinson, president of Human Rights Campaign, which supports or endorsed Biden and poured millions into his re-election campaign. She says it's wrong on the science and it's wrong on the substance. It's also inconsistent with other steps the administration has taken to support transgender youth. Ms. Allison Scott, director of Impact and Innovation at the Campaign for Southern Equality, a nonprofit organization supporting LGBTQ people in the South, called the administration's statement cowardly. She goes on to say, it's troubling. It's a troubling concession to the right-wing assault on transgender Americans. falling for their false narratives about surgical care and betraying a community or a commitment to equality and a trust in medical community. She goes on to say, let's be very clear, very, very clear. Government has no business inserting itself into private medical decisions that should be exclusively between parents, their providers, and their parents or guardians. Scott continues saying it's dangerous to begin endorsing categorical bans or limits on health care, and there is no justification for restricting transgender youth's access to the very same care that many cisgender youths receive every year. It's literally the definition of discrimination. She went on to say, we demand that the Biden administration retract this thoughtless statement and work to undo its damage. Of course, the White House had no response according to the article. Now, you see what's going on there, right? You see how bad it is for people. Because they're only focusing on no surgeries for trans youth. Cisgender kids are going to be still allowed to have every little surgery they have to affirm themselves. I've read about teen boys that have had surgery for gynecomastia, which is no different than top surgery for a trans boy. Right? It's removing breast tissue that develops for whatever reason. But it does happen. And we don't ban surgeries for that. I've read stories of people having facial surgeries, different, plastic surgeries and stuff, as teens, under the age of 18 in some states, and they're not having problems with that. There are any number of reasons why there may be a surgery on a trans minor. But the thing is, it doesn't happen that often. It's very rare. But I still don't believe a government has the right or the need to insert itself into people's private medical business. There are problems I had with the ACA because of some of its, intermingling with the government telling doctors what to do. I don't want that for anything. And those things are, later when I went through and finally read that bill, they weren't what people made them out to be. But the problem is, this is exactly what it's being made out to be. It's an attack on transgender youth. And you cannot just ban surgeries for one group of people while allowing it for others. Like was said in the article, you can't that's the very definition of discrimination. Singling out one group, saying they can't have these surgeries. Now, this article is going to go into some more stuff involving the Secretary of Health and Human Services. And we're going to get to that in a minute. Let's get back to the article. Okay. The Biden administration first expressed some skepticism to gender-affirming surgeries for minors last week, according to a report in the New York Times, which came in response to another New York Times report that the staff of Admiral Rachel Levine, Assistant Secretary at the Department of Health and Human Services, had urged the World Health Professional Association for Transgender Health, an organization devoted to researching transgender health care, to remove age minimums for gender-affirming medical care from its guidelines for minors. The draft guidelines released in late 2021 recommended lowering the age minimums to 14 for hormone treatments, 15 for mastectomies, and 16 for breast augmentation or facial surgeries, and 17 for surgeries that involve reproductive or genitals or whatever. The article goes on to say gender-affirming medical care of any kind, however, was only to be recommended to minors with a well-documented history of gender incongruence and who demonstrated the emotional and cognitive maturity needed to provide informed consent for said treatment. Now, you see what it says, what I was reading, right? You hear that. It made very clear that only minors with a long history of gender incongruence and that were emotionally and mentally able to make that decision for their bodies. And of course, that would have involved parental consent and and discussions with if the parent was okay with it too. So it's weird that these were the recommendations that they had originally put out. Now, I think I'm not one of those people that is like absolutist on most things, right? But it's going to go on and discuss a little bit about how the final draft came out and what the final results were of that paper. The final WPATH guidelines, released in 2022, removed minimum age requirements altogether, including for surgery. The group said the change, among others, will eliminate unnecessary barriers to care and foster a more individualized approach. Other medical organizations and healthcare professionals have said maturity and social support are better indicators of whether gender-affirming care is appropriate rather than age minimums. The Endocrine Society nonprofit organization focusing on endocrinology and hormone research recommends waiting until 18 for bottom surgeries. And such a procedure being done on minors is exceedingly rare. I gotta say, I completely agree with that. Goes on to say, in a statement to the Times, spokesperson for Health and Human Services said Levine, who is transgender, shared her view with her staff that publishing the proposed lower ages for gender transition surgeries was not supported by science or research and could lead to an onslaught of attacks on the transgender community. Health and Human Services did not respond to questions from the Hill about the Biden administration's stance on gender-affirming surgeries on minors. And the spokesman for WPATH did not immediately return request for comment. So let's go back to what Secretary Levine said. Said that publishing proposed lower ages for gender transition surgeries was not supported by science. But we read above that these were guidelines done by research. But she's right. I mean, Levine is right, saying that publishing things about lowering ages would be definitely lead to an onslaught of attacks against my community, for sure. It would just make things worse than it already is in this country. The administration's latest statement on surgery for transgender minors is a departure from the president's speeches, public statements, and executive actions that express unequivocal support for gender-affirming care, denouncing state laws meant to restrict or ban treatment for primarily for youth. 25 Republican-led states in 2021, or since 2021, have adopted laws that bar transgender minors from accessing gender-affirming health care, which major professional organizations say is medically necessary. In some cases, state laws limit care for trans adults as well. In Arizona, surgeries, but not other care, are banned for transgender youth under the age of 18. Access to other treatments, including puberty blockers and hormone, is protected under an executive order signed last year by the state's governor, Katie Hobbs. In Ohio, the state health department rule similarly bars minors from undergoing gender-affirming surgery. The Ohio Governor DeWine, Republican, has called the claim that doctors are performing surgeries on minors in the state a fallacy, because they're not. In April, a federal judge blocked an Ohio law banning gender-affirming medical care more generally for minors, and enforcement of a similar Montana law, which halted last fall. In June, a federal judge struck down the Florida law barring access to gender-affirming care for minors and some adults, and Arkansas's first-in-the-nation ban was ruled unconstitutional last year. At the urging of the Biden administration, the Supreme Court late last month, said it would decide during its next term whether bans on gender-affirming medical care for minors are constitutional. Now, all that said, right, is I'm assuming the reason that in the final write-up that the minimums weren't there was because lowering them would look bad, right? They'd make it look as if, they're trying to force this stuff or something. But the fact is, I don't think most surgeries should happen on anybody under the age of 18, right? That's my personal view. Now, the thing is, I also understand that everybody is different. I understand that not everybody has the same situation. There are trans youth who will not survive it if they're not able to delay puberty and get on the hormones of the gender of which they identify. And those people have long documented issues. I do believe I agree with the statement in the article that maturity and social support is far more important and far more of an indicator of whether or not something like this should take place. Now, I fully support transgender care for all transgender youth, whether it's just allowing them to socially transition or if there needs to be some kind of medical intervention and psychological help. I believe if you have a trans child, you need to go, to the right channels to get things looked at for your child. Let them do what they have to, right? Let them socially transition, change their name, change their clothes, wear their hair differently if they need to. But an outright ban pushed by the government is absolutely ludicrous. Anyhow, y'all have a great day. I'll see you down the road.